Hello, thank you for joining us today. My name is Kathie J. Today, we are joined by Dr. Isabelle Amigues. Thank you so much for being here today. Did I say it right?
You did.
Okay, yay!
And thank you for having me.
Thank you. So you are here for so many reasons. You are here because you are a survivor. You're also a doctor. So I'm getting like a 1-2 punch with you. So thanks for being here, Doc. All right, so let's start with, you're the CEO and founder of Unabridged.
MD. Yeah,
yes.
Unabridged MD. Yeah.
Okay, so tell me what Unabridged MD is. Tell me how your story is.
So it's a rheumatology holistic practice that I created after, being
diagnosed,
a patient, exactly, myself, and realizing that I just felt that the world of medicine, the system, just didn't align with my values. And I just felt more and more crushed, not having a pleasure of practicing medicine. And I wanted to see the patient as a whole. So unabridged, I love that word. I don't know why. I'm French, right?
Yes.
But I love that word. It's like the non-edited version of a book. And, and I wanted to see my patients as a non-edited version of themselves, right? Like, so when you go to a specialist in an insurance-based practice, you're basically saying, okay, well, I have joint pain, and that's all you're going to talk about. Exactly. And I wanted to hear their whole story, their trauma, their fears, their hopes, their trials, their failures. I think there's no failure, but, trials.
Yes.
And I just didn't want to have a box. And I also wanted them to see me as this non-edited version of me as well, right? Like I'm a physician, but I'm also a human being. I'm also a patient.
Right.
I care, And so that's how it started. And I love the practice. I love what I do.
No, you can tell. You can tell. And you were trained at the best. You were trained at Columbia. You were
in Paris, and Lyon, and Columbia University. Yeah.
It's pretty incredible. It's amazing. So did you study for arthritis, or all of a sudden you got, tell me how that happened.
So I started in France. I did med school in Paris, in a pretty prestigious medical school. And then I did my residency fellowship in Lyon, the first one in rheumatology. And then I moved to the US in New York City and repeated the residency in rheumatology. I'm very well researched.
Did you have to repeat it just because we were another country, that kind of thing?
You have to repeat it. You have to repeat the different steps.
So you're well versed.
Yeah. The funny part is that I actually kept increasing the years because I really love it. And so I wanted to learn. And I was afraid that the day that I would stop studying, I would stop being a fellow or a resident, that I would stop studying. And that's actually not true. You keep learning. You continue.
You have to keep learning.
That's the beauty of medicine. You keep learning. I've calculated once. I have 17 years of training.
My
but
goodness.
I love it.
Yes.
I loved it. And you get paid. You don't get paid the salary of a full, attending physician, but you get paid. And so I've always thought that I get to do the best thing in the whole world. I get to learn, and I get paid in the process. That's incredible, right?
It's a win for sure.
So that's how I felt. I knew that I wanted to be a rheumatologist almost right away in France. But I was between infectious disease and rheumatology because I love fever. I think fever is one of the most interesting symptoms.
Nobody says that. I love fever.
Well, yes, I do because it says so much. Fever is kind of like an all-over problem.
It's your body saying, I'm exploding. Something is bad, right?
Exactly, I'm inflamed.
And that interests you as the doctor, trying to figure out the puzzle.
Why? Is this infectious? Is this cancer? Is this autoimmune? Is this something we don't know?
So I was shocked when I found out that fever is a sign of arthritis.
Yeah.
That's wild.
Inflammation.
It's inflammation, right?
It's so cool. Yeah. It's very interesting.
So there you are learning. You're a specialist for arthritis, and then you yourself become a patient.
Yeah, so I was already like an attending at National Jewish in Denver, and everything was looking good from the outside, and basically it was my midlife crisis.
Okay.
And I got a cancer for my midlife crisis. That's why I say.
Some people get a car. Yeah. You got cancer.
That's exactly what my friend said.
Is that it?
My friend was on the phone and I was like, well, this is a cancer. And she was like, oh, Isabelle. And she started laughing. Like, literally, she's laughing. And I'm like, okay, I just got a really bad diagnosis right now. She starts laughing. She's like, oh, Isabelle, you don't ever do things like normal people. You couldn't just do like a broken bone or a divorce or a new car. No, you have to do a cancer. But her words just carried me, right? Because they were so positive and so optimistic that you're like, yeah, she's right. I'm just doing it differently.
This is right. I'm just going to, I want the whole load. Give it, we'll figure it out. I'm Isabelle.
My first thought was like, oh, no. I remember my first thought. I was like, I have something else to do. I'm going for midlife crisis. Why do I have to deal with this?
Yeah.
Not realizing it was part of it,
It's part of it, right. Yeah. So if I could you take me to the breast cancer diagnosis? Did you feel a lump? Were you going regularly?
No. Actually, it's actually very weird. I had gone in November for an exam, and I had even asked, I was 39 then, and I had asked the provider I saw, she was a nurse practitioner, my mom had cancer, but at 52, breast cancer. And she was like, well, you're less than 40, so maybe we could do a breast MRI. And I was like, well, and I thought at the time she had been less than 50, my mom, when she had the cancer. So I was like, oh, I don't know. And then I learned that it was 52. So I was like, oh, I don't need a breast MRI.
Okay.
And she had done like the full exam. There was nothing. And I got the diagnosis of this stage 4 breast cancer with a massive mass in March. So it probably
So this is from
fast.
November to March. Yeah. Oh my gosh.
That's usually atypical. But they say that young people have more aggressive thing. But okay, this is a word of hope. More aggressive types of cancer don't mean that it's going to be a worse outcome. It just means that it's more aggressive. So potentially, and this is what I kept telling myself, is that it's going to respond better to treatment as well.
Okay, yes. Yeah. I would have said that too, right? Yeah. It's going fast, so it's going to respond faster. Yeah, exactly, yes, right. Yeah. So your secret was staying optimistic. Is that who you are as a person?
I don't know that it's a secret. That is who I am as a person. And I was just telling this to a patient today. She was like, oh, you're so optimistic for her daughter. And I was like, I'm optimistic because I've seen how good how good things do, right? So I kept telling her, I was like saying the patient, and she's, sad because it's been a lot of years and she's not doing well. And I was like, you're not seeing what I'm seeing. When I'm seeing you, I'm seeing all of the possibilities of remission.
Yes.
And, but that's true. I'm not making this up. I'm actually seeing the remission. I'm seeing the path forward. And so, yeah, so you were asking me, I wasn't going through, I was going from this midlife crisis. And one day I was crying in my shower and started like, I don't know, you're crying and then you're like looking. Sometimes you need those moments when you feel sorry for yourself.
Yes, you do. We all do. Yes, and it's okay. You can't stay down too long, but you can go there.
So yeah, right. Like I'm optimistic, and then some other times I need those time, and I was just like crying because I didn't know what I wanted in my life, and just like at one point I'm like, this is not supposed to be here. And it was actually pretty incredible. I got a biopsy like almost right away because I was leaving for France for like 4 days.
Oh, wow.
Yeah. It's like the universe happened, right? I was leaving for France because I was going through my midlife crisis. We were going to have a party with my friends about my midlife crisis. This is why I was going to France, to have a party for my 40th midlife crisis.
Right.
And I basically had a party to say, yeah, no, we're not letting this stop us, right?
Right, absolutely right.
I still remember, and thank goodness for the people who are optimistic and give you like a good outlook. But yeah, so yeah, I am optimistic. Of course, I have my moments, but I am overall optimistic. One, because I think we all are going to end our life at one point. Like not ourselves, but
it ends.
Life ends.
Yes.
And so then you make the most of it.
Yes.
And you can be optimistic because there's no point of, like, even if you knew that you may die, right? What's the point in living in that?
You're so right.
Right?
You're so right, Doc. You're so right. So why not be happy with the little time you have
Exactly.
here?
Yeah.
But some people are living in such pain, and that's who you're trying to help, or
Yes.
people that live with arthritis.
Yeah, absolutely.
So let's, before we get to the arthritis, let's do the breast cancer. So you went through treatment and you are in remission. Yes.
Yeah, it was really cool. I had a wonderful oncologist that has retired since, which is always what you want.
Yeah.
You want to outlive your raumatologist.
Yes,
and your
you're definitely right.
And she was, I love her. And yeah, she had told me, you're gonna see those cancer, they can shrink.
Yes.
They can shrink. Like within 3 weeks, it can shrink. And and I was just like living in that. I'm like, I'm visualizing.
Like you said, you visualized it. Yeah, you visualized the path. You said.
Yeah, I believe in that. I think that the same way that Olympians visualize, Olympians, but also like very good music players.
Yeah.
I played the violin, and I would be taught by my teacher, visualize what you're about to do. Where do you place your fingers? So you're visualizing yourself, right? And it's the same thing with sports. And I don't see why it couldn't be the same thing with everything in our lives.
Yes, it is.
You're going to have a tough conversation, visualize the outcome.
I do, actually.
You do?
The night before, like if I know I'm having a big meeting the next day or something, I visualize already having that meeting and it going the right way, and saying the right things. I will visualize ahead of time or go to bed and visualize. So
yeah, I love that.
So I love that. I love that because that's one of the things I love about you is even though you are Western medicine.
Yes, and
you were trained Western medicine. There's a part of you that is all about the meditation, the energy work, the belief, the manifestation.
Yeah.
That is not Western medicine. So talk to me. Talk to me where they combine.
Okay, this is so cool because so I go through this stage 4 cancer, and I was in a place where. Because I was going for this midlife crisis, I had opened a lot of doors.
Okay.
And I had started talking to my friends that I had not talked for many years.
Oh, I love that.
Okay. Oh, yeah. People are.
You were really trying to.
Yeah, I was not doing very well. And in fact, I wasn't doing well before I knew about this, right? And so I had started telling you the universe.
Yeah, no, I believe it. I believe in the universe.
However you want to call it.
Yes.
Right? But basically, it was like, I had already reached out because I wasn't doing well. And I had reached out to therapy, coaching, meditation. Like I remember my sister say, meditate. And I was like, yeah, I'm not someone that meditates. And I was like, I try. I tried. It didn't really work. But then it felt vital then. Because then I was like, okay, I don't want, because I don't know how much time I have, right? Like at that time.
Right.
So I was thinking, I don't know how much time I have. And I don't want to leave whatever time I have, like in fear, and I want to live, and I want to visualize that this is going to be okay, and I want to acknowledge the fear, and I did. I acknowledged the fear, but I didn't want it to take over.
Yes.
All right.
Because so many people, that's what happens, and then they visualize their death.
That's exactly
They start
it.
visualizing what clothes they're going to be buried in. What are you doing?
Yeah, exactly.
Yes,
Yeah,
right.
That's exactly it.
You're right. Okay.
And I think that the doctor has such a powerful role in here.
Yes.
Right? My doc was amazing because she put on a piece of paper 95% remission. And I was like, cured. She said cured. And I was like, I'm a rheumatologist. We don't use the word cure. And she's like, we do. And I was like, okay, cool. We didn't know it was stage 4. Right?
Oh.
What did she do though when she told me, well, it's stage 4, right? There's metastasis in the liver and the bone. And she never told me, ever, the chances of a cure or not cure. So I kept the 95%.
In your head.
And I'm a physician. I knew it wasn't 95%, but I kept the 95%.
Right, but you were like 95%.
Yeah.
It even feels better right now with me saying it. And I don't have,
exactly
95%.
And what does a doctor do? Like, it can give hope or it can remove it.
Yes.
And even, you have to be so strong if a doctor tells you something terrible. Because, you believe, even if you don't believe in what they have to say, you believe in what they have to say.
Yes.
And so that's something I realized then, right? So then coming to the meditation and all of this thing, I read a book. So I have a friend, Marie. if you ever listen to this, you're amazing. So
We love you.
Exactly. Marie was reading this book and she had told me, I'm starting to try to meditate. And I was like, okay, you know what? This is now the third person telling me about meditation. I'm going to do it. And then she told me about this book called The Miracle Morning by Hal Elrod. And that
The
book,
Miracle Morning?
Miracle, Miracle. My French
American
accent.
Morning.
No, miracle, like a miracle, like.
Oh, Miracle. Miracle.
thank you.
Okay, Miracle Morning. My bad. I'm sorry. Yes.
No, I cannot say it.
I've been catching everything else you've said. I'm sorry, Isabelle.
There's
Okay.
some words. Rheumatologist, super hard. Miracle, super
Right.
hard. So The Miracle Morning. And it's a very small book.
Good.
It shouldn't be this like life-changing book. But basically, it teaches you a path to meditate, doing affirmation, doing visualization, exercising for 10 minutes per day. I mean, we can all do that.
Yep.
And then writing for 10 minutes per day and meditating, right? And I was like, I'm going to do it. I'm going to do everything he says. And I started doing everything he said every day, 1 hour for me. And I was like, I don't want to know if this works or not work. Right now, I'm considering myself as a patient.
Okay.
And I don't want to know if this works or not.
You're just doing it.
I'm doing it. And then once I was in remission, and it had helped me so much, I was like, okay, I wonder what's the data behind this. I didn't look at the data for cancer. I started looking at the data for rheumatoid arthritis.
Okay.
It's so cool. Meditation.
I love that.
It's so cool. Yeah. Meditation decreases inflammation.
What?
Yeah.
Yeah, because you're calming your whole body down.
Exactly.
Right.
Well, so this is so cool. This
Okay.
is where I get so excited.
Okay,
right?
go for it.
So meditation, visualization. How hard is it to actually, but you can actually visualize like healing, decreases also RA pain, rheumatoid arthritis pain.
Wow.
What else? Breathing, exercise, decreases your heart rate, decreases inflammation as well, okay? All right. So now we move 6 years later, and we all heard in the New York Times the Reset RA, I think it's called. Yeah, Point Reset RA. So basically, it's a device that stimulates the vagus nerve. And what does that do? It does exactly the same thing that meditation does, that visualization does, that writing does, journaling does, that exercise does. It stimulates our vagus nerve.
Okay.
We decrease inflammation. They can put patients in full remission with just stimulating their vagus nerve.
Really?
It's really cool. And so,
Because by stimulating that nerve with the meditation and the calmness, you immediately are taking the inflammation down in your body, which is a lot of the pain that is people are experiencing. Okay.
and
I'm still holding it. This vein right here.
Yeah. Well, you have plenty
know.
of technique. You can do the box breathing. You can do diaphragmatic breathing. You can massage your carotid if you want. If you're less than 50, because if there's plaque, you can like dislodge them. So you don't want that. But you can. What else? There's like you can get like one of those external stimulator and stimulate the vagus nerve.
That's amazing.
Cold plunge can do that. There's a ton of things. And the thing is, to me, I'm like, why would you want a stimulator inside when you can actually stimulate it with all of those other things, right?
Yeah. Okay.
So, but it was really cool because it's been known now for 20 years out of this work, but there's no money. There's no money in this.
Okay.
Right? Like,
so that's why people don't talk about it.
we don't talk about it because because you have to be really convinced that this works as a physician. Like the first time I started talking about meditation, I felt like an imposter talking about that.
Yeah.
Because I was like, well, I'm a physician. They're here to get medication.
Right.
But that's not true. Patients come to a physician to get a path forward no matter what the trajectory is, right? Like what you're going to offer them. So I tell my patient, all of my patients do that because first of all, it helps with rheumatoid arthritis, lupus, Sjogren, all of this. But it also helps with cancer. So that's the thing. Like looking back, right now, Dr. Calabrese is a rheumatologist, infectious disease, and immunologist at the Mayo Clinic.
Yes.
No, sorry, Cleveland Clinic.
Okay.
He's big on meditation.
Okay.
Super big. And they started doing tests like meditation. Like, so they started looking at meditation to see if patients would respond better to immunotherapy in cancer.
Okay.
Yeah, I don't have the data yet. Like, we don't have the results.
Right.
But how cool is that? And I bet that it helped me heal.
Yeah, right. Without, yes, I bet you, yes,
I
because
had almost zero complication of chemo.
That's
I had
amazing.
no complication. Yeah. And
it's amazing. It's truly
but is it
amazing.
amazing or is it just normal? And then we just didn't know that this was the thing we should all tell our patient. But the problem is you have to have a receptive patient.
Yeah.
Because if I suddenly start, hey, you should meditate.
Yeah, I'm like, I'm coming to you telling you that I have cancer. Like, don't tell me to meditate. I can't get my, meditation, you have to.
Yeah, it's hard.
You got to really calm your head down and all the things that you're going through. But I do believe in the benefits of it. So when you are helping your patients with their arthritis, is it just rheumatoid or is it all the different arthritis?
Any inflammatory, gout, rheumatoid arthritis.
And there's over 200 different arthritises. Is that
a lot of them?
That's crazy.
Yeah, there's a lot of them. So
it could be here. It could be in your liver. You said earlier.
So no, the liver was the history of cancer.
Okay.
Yeah. I mean, our rheumatologic disorders are inflammatory. Most of the time, it's all inflammatory. It's usually systemic in the sense of it goes everywhere.
Yeah.
So while it's going to affect, if it affects the joint, it's really nice for us because it's pretty obvious.
Right.
But it can affect only the heart, only the lungs, only the...
It can.
Yeah.
And how you wouldn't know.
Well,
or would you?
That's when you want to be well trained and realize, like, oh yeah, there's pericarditis, which is inflammation of the lining around the heart, and you're like, okay, what's the reason for that? And then you realize, oh, there's also a skin rash. Oh wait, there's also
fever
fatigue or fever, and then suddenly you're like, oh, let's look at the blood work, and then you find that maybe there's positive dsDNA and ANA, and that's maybe lupus, right?
Wow.
Yeah, but it could be also nothing related to lupus. It could be pericarditis that's autoimmune or anti-inflammatory, right? So
wow,
so many reasons to have inflammatory issues. Yeah.
So therefore, we're speaking today with Dr. Isabelle Amigues. Thank you so much for being here. So therefore, because there's so many different ones and you don't know really how we're treating it to even attack it, maybe that's the reason why you're saying meditation. Like, I know that we can work on the inflammation part. I know I can get you calm with the pain, because it's got to be an everyday struggle.
Yeah. So, the way I think about it is this. There's not much, as a patient, when you come to see your doctor, there's not much that makes you feel empowered, right?
True.
And so, like, the way I practice is I want my patients to understand what they are going through. So, right, like, I'll explain my thought process to explain, look, this is what I think you have. This is the reason I think you have it. Look at, you have joint pain. It's worse in the morning. It's associated with morning stiffness. That means it's an inflammatory arthritis. Now, it's involving your back. If it's involving your back, then that is probably a spondyloarthropathy. When you have that, we look for all of those other things. When you have, depending on this, we offer this treatment. And so then you explain, that's the first type of empowerment, understanding, seeing the path forward to remission, right?
Yes.
And then say, and on top of the medication I'm about to give you, here are all of those different techniques that I would like you to try.
Right.
That's empowering.
Empowerment. Yes. Super absolutely,
empowering.
Doc. Yes. Mm-hmm. Okay. So say for instance, and I'm sure you have it, you have a lot of patients that are older that they don't understand the first thing about any of that. They're expecting medicine and pain management. I mean, how do you help them?
It's rare actually that a patient would say, I will do whatever you tell me to do. It's truly.
I thought maybe we.
No, there's not a lot of people
you're right.
that say that.
You're right.
And I think that even if they were to say that, I think it's it's funny. I always say this, which is I always review their labs, and I always tell them, I'm going to review your labs. I could tell you that everything is absolutely normal, but the other brain that you have needs to have reassurance. So we're going to go through all of them right now so that I reassure your other brain. The amygdala and all this. So it's the same thing. It's like if you understand how something works, then it's going to work better. It just is.
Yes. You're right. You're so right, Doc. Mm-hmm. So when it comes to arthritis and the inflammation, you are a huge advocate for helping with the Arthritis Foundation.
I love the Arthritis Foundation.
Yes, we love you.
It. Yeah.
2 years ago, you were the guest speaker for the Party of the Stars. It's the new thing that the Arthritis Foundation's doing for women.
It's so cool.
It's
I love
so
it.
cool. Yes. And last year we had a new location at the Cherry Creek Clubhouse, and you kind of were there to pass the torch, and it was awesome. But tell me about why you love the Party of the Stars. Tell me about your experience with it.
So thank you for asking this question. It's such a good question. I have a thing for, I love community. This is, I don't think I would be here without my community.
Oh.
And COVID also showed us how important it is to have communities. And now we have, other things, the world is very stressful right now. But if you lean on your community and if you help your communities, they help you back. And so the community of the Arthritis Foundation is phenomenal. And then the Party of the Star made it, I like, small, tight group of people. Mm-hmm. And there is something about women, empowering women.
Yes.
And so when they said that, I was like, I love this so much, right? And one, because rheumatologic disorders are usually in women, right? So I take care of a lot of women. So that's number one. Number two, my mom is a very strong woman. She's a Corsican woman. I'm half a Corsican. We're a strong woman. So I don't know. There's something about women. And I remember having this discussion with Lisa, and I was telling her, she was like, "You're the star, the first one." And I was like, "No, patients are the stars.
Yeah.
We are all stars. There's not one person that's bigger than the other. We all shine." And so I loved how it went, because I don't think they knew exactly the star party of the stars,
Yeah,
right?
yeah.
So it was this idea of everyone is important. Everyone is extraordinary, right?
Agreed.
And so we started like that, and I loved it. And they were asking me to share my journey. And that journey is not for me to hide, because it changed my way of practicing medicine. It changed my way of being as a human being. And so then I want to give back. And I'm very, very, very grateful for this cancer history. And so, right? And so
says no one ever.
Yeah. Actually, you wouldn't know.
I think actually they would. If you survive it, everyone should wear that badge.
Yeah, there's a lot of people who are very grateful for it, actually.
Yeah.
And so you're like, I've learned so much from this experience, right? And so you're like, well, I was very touched that they asked me to share that story. So I did. And I was very, very happy to. And to give to continue to do this.
Yeah.
There is nothing more rewarding than a movement that starts and continues. You know what I mean?
Yes.
You can create whatever organization, but what's the most beautiful, it's when it continues without you even.
Yeah, right. You want it to continue, right?
Yeah.
And it's going to be, the next one's going to be October 25th. We're going back to the Cherry Creek Cherry Creek Clubhouse, so that's nice. It's going to be wonderful. So before I let you go, I have some questions real fast about arthritis. So is it, so I could get arthritis? The people don't know if they have it, right? I mean, it's such a scary... you don't know who's going to, it could be a trauma trigger that causes your body to want it.
So I don't think we should be scared.
Okay. Well, yes. Okay.
All right. No. This is important.
Talk to me. Yeah.
So number one, we're in 2026. The treatments keep improving. And I'm going to be very clear. If you have an inflammatory arthritis, that's true. There is a genetic component. There is also some infection that can trigger inflammatory arthritis, or trauma that can trigger inflammatory arthritis. But the truth, and this is what I tell all my patients, if you have an inflammatory arthritis, I got you. We have good treatment.
Oh, good.
Right? The other type of arthritis, which is the wear and tear, more like as you grow older, you get more. Mm-hmm. That one is not dangerous at all. It's just a very annoying pain. But the truth is that it never, it's usually not constant pain. And it's up and down and up and down. It's just one of those where, you're like, ooh, I have a little bit of pain. And then it goes, it gets better.
Yeah. Or, oh, it rained today.
Yeah,
right.
exactly.
Yeah.
And so that one is not dangerous. So then it's just, a little bit Tylenol. And then I'm certain that in the next 10 years, we'll have a treatment for that.
Wow.
Why not?
Well,
Right?
yes, I hope so.
That's what
I
it
hope
is.
so. That's why we need to give more money to the Arthritis Foundation
Absolutely.
for more research, so doctors like you can continue helping us
Yeah.
get better. Before I let you go today, what would you like us to know about arthritis or life, meditation, the importance? I mean, you are glowing.
Thank you.
I think all of us want a bit of what you got.
Oh, well, you're getting it.
So, yeah.
Yeah. So I think there is a ton. I'm not an optimistic without reason, right? I'm optimistic because there's a ton of reason for it, because I've seen a ton of patients do very, very well.
I'm optimistic because there's a ton of reasons for it.
Yeah, but that's true, right?
It's so true.
And because of that, then I think that the default should be optimism. Should be the default in medicine in 2026. I'm not saying in 2000 or like in 1950s. That's a different story. But that's number one. Number two, I think it's really exciting to see that, all of those techniques that we thought were kind of woo-woo, like you're talking about energy work. I don't do energy work personally, although I would love to. I would love one day to put my hand and then cure
Wouldn't
someone.
you could be like Mr. Miyagi from that movie, from The Karate Kid. And you just, ooh, yeah, that'd be awesome.
I know, right?
I'll come see you at lunchtime.
I know, right? Like this says in my
Touch
journal.
me, Isabelle.
Yeah, exactly.
Right, that would be amazing.
But I would love that. I do, honestly, I do think it probably exists.
Yeah.
And I don't know how it works, but I'm open to it. And I think that the placebo effect is 30%. So why not have it on our side?
Yeah.
We don't know how the placebo effect works. We think it's the mind, right? So then knowing that from a scientific perspective, let's take our thing and say, okay, I'm going to do the meditation because I'm going to quiet my mind so that I don't think of the worst thing.
Yes.
But I'm going to start thinking of the right thing. I'm going to visualize so that I'm thinking of the best thing. Right?
Yes.
And I'm going to be grateful for whatever happens to me.
Yes.
Right?
What are the results if you start to act that way instead of doom, doom, doom?
Yeah, exactly. And suddenly you're like, oh, my life is actually much better than I thought. Right? If you look at where we are today, right? We are here, we are sitting, a good company. And then you're like, I could have started with, oh my goodness, I just heard something in the news. Oh goodness, and what's going to happen?
True.
But you're like, no.
Already the energy's changing just with you talking. Yeah.
But no, we're here, present. And that's what I love. It's like being present. And I'm not always there, right? But I can.
We can't always be there.
Exactly, right? But I'm making a conscious effort to try to really be present and say, okay, our life are limited, all of it. It goes so fast, right?
Yes.
I see my kids grow so fast, but I'm so grateful. And I'm so grateful to see them grow. And it actually makes me realize how fast it goes, right? And I think if we live in that, and if we live in this gratitude and this realization of it's just a story we tell ourselves. You can tell the story in two different ways, a negative, actually in a 1 million way. But you can choose a more positive way, more optimistic way, or a more negative way.
Yeah.
And this is okay.
Right. That's right.
So that's why be careful of your thoughts.
Because and the words coming out, because it feeds
the words coming out and what you're telling yourself and what you're telling others. And honestly, that I feel like is my
your purpose.
Yeah, my purpose. It's making sure that people understand that we have choice and we have agency over our lives, right?
Yes.
Yeah.
Yeah, I don't think we remember that enough. I think we just go with the flow too much.
A lot, yeah.
Yes.
And it's good sometimes, but just realize that the flow comes from your thoughts too.
Yes, it does.
Yeah.
Isabelle, Amigues, thank you so much for being here, doctor. I truly appreciate it and everything you're doing for everyone with arthritis. Again, I love hearing you speak. Any event you're a speaker at, I'm going to.
Oh, thank you.
Thank you so much. And arthritis.com and the tickets, we will have a link eventually on where you can come to the event and you might get to meet her in person over a drink. Okay, have a great day. Thank you so much.
Kathie J.